Hello there. Okay, I'm not used to recording on Zoom. I've never done it, so I'm gonna hope for the best. Gonna go ahead and share my screen. Okay, and if all goes right, I should be able to just share from the beginning. There we are. All right, I think this is gonna work. I will watch the playback after, and if not, I will try again, but I'm hoping for the best. Okay, so for my media project paper, I chose ageism and substance abuse disorders. The article that brought this on was Ageism, Stigma Hinders Response to Senior Alcohol Use Disorder, which was a roll call article by Jessie Hellman. She stated that according to 2021 National Survey on Drug Use and Health, 7.6% of adults 50 and older had an alcohol use disorder in the past year, a lower rate than other adult age groups, but one that, like these other age groups, has increased in the recent years. Elder adults often face problematic situations such as ageism in this area before even getting to the issue of substance misuse in their lives. Um, Many substance abuse disorder symptoms for older adults go unseen and contribute to the rising problem. And this happens starting in the doctor's offices and just in the general care of older adults. Older adults are more likely to die from alcohol-related causes, mostly from chronic diseases associated with years of drinking. In 2020, the rate of alcohol-induced deaths among 55 to 64-year-old men was higher than any other age group, according to the CDC, and was the second highest among men aged 65 to 74, as mentioned by Hellman. As I had mentioned, this starts in the routine doctor visits. Healthcare practitioners tend not to screen for excessive drinking or substance uses. This is a huge problem and needs to be rectified when it comes just to the screening alone. Many write off the possible signs of their use to being signs of other issues that are commonly described in the older age bracket. These symptoms of excessive substance abuse or drinking can mirror the symptoms of aging, such as depression, anxiety, disturbed sleep, lack of memory, and so many others. Something even more to consider is the lack of symptoms. Older adults are often more susceptible to the effects of drugs because as the body ages, it often cannot absorb and break down drugs and alcohol as easily as it once did. This means that the body for everyone is very different. Even as we age, some people might show an increase in these symptoms that get swiped under the rug. Others might show a lack thereof. Prior to even being in the field, many of these healthcare professionals do actually not get enough exposure to the curriculum that helps teach students the way that substance use disorders affect this age population. And this certainly does not lend a hand in having the future workers be more open to the screening process and diagnostic processes in older adults, which means also not in treatments and resources. Why this is a problem. By 2040, some 20.5% of the US population will be 65 or older. This was mentioned by Hellman. There is always going to be a population of adults that are older. Practitioners specializing in geriatrics has continued to be very low for quite some time. After the COVID pandemic, much like other specialties, this has gone down even more significantly. With less practitioners in the specialty, there are even fewer that are in suitable training or have taken suitable training in substance use disorders. The shortage means that even when the population needing to be served gets higher with time, those able to do so will still reflect that we cannot treat these growing numbers. And in taking steps and actions, we can aid both in the current issues that are rising and even help future matters. So what can be done? Help advocate for more age-appropriate accessibility when it comes to treatment and resources. I think that we kind of can fight many fights if we simply even just provide resources for people to explore on their own before they get more in depth with them and bring in their healthcare provider. And it really takes no time at all for many practitioners of many different kinds to just have that accessibility there for the taking. More age-specific programs, as there's not many facilities that have programs that focus on these specific age groups, and they have the very little that there are really tend not to have accepting of Medicare or other types of insurance, and they can be extremely selective. And also, education needs reformatting. It needs to be more inclusive with a curriculum for the care of substance abuse disorder in the older population. So students would be equipped when they reach the field. But also, I feel that the exposure to this curriculum could also spark interest in students that are choosing their specialty, and they might choose to specialize in geriatric care, which again is very beneficial, especially with the growing population rates and kind of the projected numbers of how the age brackets will swing in the next handful of years. And I think that's quite important. And lastly, because I'm going to hone in on this, when it comes to screening, also in comparison to some of the topics that I've used here, some of the tests, some of the information that I've taken, which I will have in the reference slide at the end, matches with this course for modules 3 and 4. A lot of that should be familiar and connects beautifully with this topic. So screening, the simplest way to contribute to improving the problems with ageism and substance abuse disorders would be to rectify that lack of screening. Tests like short Michigan alcoholism screening test, which has been around since 1991. This is the geriatric version. There's a young person's version. So this one is more geared toward that. It can be suggested or administered without the current disregard of present or lack of symptoms in older adults. And even there are even assessments that do not require somebody to administer them. There are self-assessments. The self-assessment of drinking patterns from the AAGP in 2022 is an example of a resource that can be given to help people evaluate if this is a subject that should be brought to attention to somebody that they're just talking to, who's family member, who's a friend, to their health professional, to anybody, to a counselor. It's a door that can be opened, and it's something that should be considered as a resource that should just be given and accessible and present, just to be acknowledged and taken. So in rectifying the lack of screening, we can then move on to other methods in research to better serve this population and decrease the number of substance abuse cases in older adults. So, and as I mentioned, here are my references, the Hellman article, along with the places to actually find the screening. So you can go ahead and look at those. They're also in different modules that we've learned. And yes, so I hope that you liked the presentation, and I'll look forward to the different comments and try to respond to all of the ones that I can if I see any questions or if I missed an area or suggestions on other topics, because I think that I really do want to dive deep into kind of reflecting more on my knowledge base and kind of expand that even more, especially knowing what I know now. So from the different articles that I've read and different material that we've learned. So thank you so much. And yes.